All right. So we're in live now. So Nabila, if you want to record your the group attendance, yeah, it would be great. And yes, you can start now.
Okay. Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Nabila Ani binti Abdul Halim, and today we would like to present about the trigger one, which is nak slide. We tak ada next slide. Oh, boleh kita sama. Okay, which is about a 7 years old boy who was bitten by a dog. Okay, so first I would like to present about the FILA table. Okay, what is a FILA table? It consists of FILA, which is facts, ideas. Saya apa? Saya kata apa Okay, fact, idea, learning issue, action. Sorry sir. KP bising. Okay. Okay, so for the first one is for the fact, which is this is like a boy named Gopal. He is like 7 years old boy. He was chased by a stray dog for about 200 meters before he fell. Okay, so the dog then aggressively bite his thigh, and no previous medical issue. Boy itu memang like he got no complication lah macam tu. So itu like for the fact. And then for the idea pula, what will happen? What will the possibility that will happen? So I will pass this one to my friend, which is Kolila Izati.
Okay, for I, is the ideas that we can get from the situation. For the possible diagnosis, for the infective one is first staphylococcal, rabies, tetanus, and capnocytophaga. For the non-infective one is nerve and muscle damage, broken bones, scarring, sepsis, and the last one is possible death. For learning issues,
Okay, for the learning issues, it's about like what will happen to the body, to the mechanism of the body. Okay, so for the learning issue is what we have been taught in the class, and we need to apply it in this slide. All right, so for the first one is how fight and flight response. We have learned this in anatomy, nervous system anatomy. And for the second one is what is the transmission of virus between human and dog. This one also we have been learned in microbiology, in like the topic of like the virus and bacteria. And then what are the signs and symptoms of infective disease, and how the mechanism of general infections. What is the treatment and management of dog bite? This one I'm not so sure if like we have been learned about this, but I think that it is like relate to like kita tak belajar rabies kan? Micro kan? Oh yes. We have been taught this about rabies and all in the microbiology class. Sorry sir. And like what is the prevention of the infection and how the mechanism of blood clotting. Blood clotting we have been taught in the blood topic of the anatomy that we have been learned previously. Yeah. Action plan I will pass to my friend.
okay, for action plan, first is to explain the fight and flight response. Second, to determine the transmission of virus between human and dog. Third, to identify the signs and symptoms of infection. Fourth, to explain the mechanism of the body response to the dog bite. Fifth, to identify treatment and management of the dog bites. Sixth, to determine the prevention of infection. And the seventh is to discuss the mechanism of blood clotting. Okay, I'll pass it to my friend.
Okay. Okay, for the first action plan is fight and flight respond by the central nervous system and endocrine system. So, first and foremost, when the Gopal see an aggressive dog, it is immediately will produce impulse to the photoreceptor, and the impulse will carry by afferent neuron to the brain at the hypothalamus. and then it will go to spinal cord at the cross section and further transport by afferent neuron to the adrenal medulla to secrete epinephrine into the blood. And then this will and then it will proceed to the endocrine system. Okay, and epinephrine molecule bind to the receptor on the molecular cell and muscle cell. Then relay molecule transmit to the signal ultimately active an enzyme. The enzyme is enzyme kinase A. Then the enzyme will break down the glycogen to release glucose that through the leg muscle. Then Gopal able to run fast. Okay. What is the effect from the hormone epinephrine? First,
Which organ secretes epinephrine?
adrenal gland, kidney,
Again,
kidney.
Nasratul
Adrenal-
Hamizan, do you agree with Camilla?
Yes, Doctor.
What yes?
I agree that it's from kidney.
What from kidney?
Epinephrine.
Epinephrine. Fakihah, where's Fakihah? Do you agree with Nasratul?
Yes, that's it. Epinephrine is from kidney.
Louder, Fakihah, shout. Say louder.
Yes, doctor, because epinephrine is from kidney.
From kidney. Huda, do you agree with Fakihah?
Yes, doctor.
What? What is it?
I agree that epinephrine is from kidney.
Shikin?
Yes, Doctor.
Do you agree that epinephrine from the kidney?
Yes, I agree with that.
Alia?
Yes, doctor, I agree with epinephrine that comes from kidney.
What if I say it's wrong? It's not from the kidney.
Adrenal gland.
Are you sure it's from the kidney, Camilla? Khalila?
Doctor, we are sorry, but epinephrine is actually made and released by adrenal gland, which is it at the top of the kidney.
Aha, so you change now? Now, so it's kidney or not kidney?
Not kidney.
So it's from where?
Adrenal gland.
Okay, so you mentioned here is adrenal medulla. It's not adrenal gland. So what's the difference? What's the difference? Can someone tell me?
Adrenal gland has two layers.
Okay, what are they?
One, adrenal medulla and adrenal cortex.
So which one is which? Which layer is which?
Adrenal medulla will secrete epinephrine and norepinephrine, while adrenal cortex will secrete hormone mineral glycocorticoid and glucose.
Okay, so based on the structure, which comes first? Which one is the outer layer? The top one?
Adrenal cortex.
Cortex. Okay, the inner side, we call it adrenal medulla. And adrenal gland is a part of endocrine system. Okay, so it's like a pancreas. It's a part of endocrine system that produce the hormones. Did I taught you about the hormones before? I teach you, right, about the hormones? So we
Yes,
have
sir.
the adrenal gland on top of the kidney, both sides or only right or left side? Atika, is it both sides or only one side? The adrenal gland on top of the kidney. Atika, this is PBL session, so you have to talk more. You have to explain more.
Both top of kidney.
On top or at the bottom?
Top.
What is the shape? Can you describe the shape?
It's like a bin.
A bin is the kidney. What shape of the adrenal gland?
Triangular shape. Right. Triangular shape.
Triangular, like a pyramid, right? Like a pyramid. Yes. Okay. So Camilla mentioned that the adrenal cortex is the outer layer that produces the steroid, corticosteroid, or corticosteroids. Is it? Okay. So the adrenal medulla produces the epinephrine and norepinephrine. What's the other name of epinephrine and norepinephrine?
Adrenaline and noradrenaline.
Adrenaline or noradrenaline. Okay, so some books they mention epinephrine, some books mention it as adrenaline. Okay, so when you are in anxiety, like if I told you after 5 minutes we have quiz, so we're gonna have quiz, so you got this adrenaline rush. Okay, so your adrenal medulla start to secrete these epinephrine hormones. Okay, so what does it do? If I told you, okay, in 5 minutes we have quiz. Once the adrenal medulla secrete the epinephrine or adrenaline, what will happen to your body? Nabila.
Sekejap. Tanya. Tadi saya tanya efek
What happens if the adrenal medulla produce the epinephrine?
Yang glycogen tu. The glycogen broken down to glucose and dia akan increase the blood glucose. Increase blood pressure, increase breathing rate, increase metabolic rate dengan change in blood flow pattern. Tu sir.
Okay, brilliant, brilliant.
Yeah.
So that's the
Thank you.
effect of the epinephrine. So you become more sensitive, right? Here you mentioned about the increased metabolic rate. Your digestion might be increased, the digestion rate, your blood pressure, okay, easily get hypertension, and you have the increased blood glucose level or hyperglycemic, and you become more alert. The answer is on the screen. So you become more alert. However, I'm a bit confused here because you mentioned increased metabolic rate. At the same time, you mentioned about the decreased digestive system activity. What do you mean by that? Huda? What do you mean here? Increased metabolic rate and also decreased digestive system activity. Is it the same thing or is it different thing?
Different thing.
Why do you think so? Nasratul? Is it the same thing or is it different thing?
It's different.
Why do you think it's different? What's the difference? What's the differences? Atika? Do you think it's the same or is it different? Increased metabolic rate and decreased digestive system activity.
I think it's different.
Why? I want to know why. Why do you think it's different? Can you explain? What is metabolic rate? What is metabolic rate?
We utilize the energy that from food digestion.
Okay, so from food you will make the energy.
Yes.
Okay, so when you eat the food, it will be broken down by your digestive system and they will be converted into the ATP or energy. Of course, this is the type of glucose. So from glucose, you will produce the ATP. So that is the increased metabolic rate or decreased digestive system activity.
Increased metabolic rate.
So you're talking about the food that you take, so your energy will become more. Okay, so now you're focusing on the energy. How about the decreased digestive system activity? Fakiha? I can see there are lots of answers on your in your brain. You want to share? What do you think? Since you mentioned it's different. You just answer based on your understanding. It's okay.
Doctor, what is the question?
The question is, what's the difference between the increased metabolic rate and also decreased digestive system activity? What do you understand by digestive system activity? It's a very simple question. How old are you now, Fakiha?
19, doctor.
So you have spent 19 years of your life just to eat and digesting in your stomach. So what do you think about your stomach doing for 19 years?
It keeps digest food and repeating the process.
Okay, digest food from what to what? Think. Don't ask your friend. From what to what? From
Food to energy.
Food to energy, yes, but from the size. You bite it, right? You chew it from the bigger size into a smaller chunk.
Yes.
So it's easier to be absorbed by the intestine or in the stomach. But when we talk about the digestive system, okay, it's all about the food being converted from the bigger size to the smaller size. Okay, and along the way, it involves several molecules or several enzymes in order to digest it further and further. So it becomes smaller, right? So you have a lot of acids, you have pepsin, you have renin, okay, in your stomach in order to digest the food. So when we mention about the digestive system, it started from your teeth, goes down into your esophagus, and then your stomach, and inside there will be some crypts or lining that produce certain acids like hydrochloric acid in order to maintain the good pH for the digestion to occur. All right, so that is all about the digestive system, nothing to do with the energy production. All right, so in the case of this person, Gopal, the adrenaline or the epinephrine, it will increase the energy production based on the metabolic rate. Okay, so the ready energy that is already inside your body, okay, it will be increased, it will become higher, because you need to prepare your body to run, right? So you need double the energy or more, or triple energy. So the metabolic rate must be capable to produce double energy. All right, so this is the stored energy in your body system. In your system, when you are fasting, for example, during Ramadan, you are not eating, you are not drinking, but your body has some energy that is stored in the cells in the form of what? In the form of what?
Adipose tissue.
Yes, some say ATP, but it's actually the glucose. The glucose inside the adipose tissue or adipose cells. Okay. Some book mention is in the form of ketone bodies. So even though you are dehydrated during Ramadan, but your body still have this stored energy inside the cells. Some of these cells, they reside inside the lipid cells or the adipose cells. Some inside the muscle cells. They've been stored there. So in the case of this scenario, Gopal tried to run, and the body increased the metabolic rate in order to use all the stored energy that they have, keep it inside the adipose tissue or the muscle tissue. Got it? But now the digestive system is not working. It's not functioning at this time because the body already inhibit this process. Okay, while running, the body stop this normal digestion process. What happens if you are running and then the digestion still occurring. What happened to your body? Nabila, when you run, what happened to your body?
Yes,
When
sir.
you run, why our body stop the digestion process?
Because nanti cepat penat tu. We will get tired easily.
I don't know.
Saya dengar pula memang. Sir, repeat the question, sir.
When you run,
Huh?
why do you think that the digestive system is inhibited? It stopped.
Oh, it stopped. Because I think like because okay kan dia ada blood flow pattern. So blood flow tu dia akan pergi dekat tempat yang macam ada masa lagi needed tau. Faham tak? Sebab tu dia stop sebab dia tak function pun time tu. So kalau tiba-tiba dia pergi dekat tempat yang digestive system, tiba kita sakit perut time tu. Faham tak? Macam dia cepat sangat digest.
Okay, excellent.
Saya
Okay,
rasa lah,
makes
saya rasa
sense.
macam salah.
Alright. So if
Ah,
that's
cramp.
the case,
Oh, cramp.
okay, so in that case, your body kind of know where to supply the blood, okay, where to supply the oxygen. So in this case, where do you think the most needed tissue for the oxygen?
Muscle.
Yes, what else?
Cardiovascular system.
Cardiovascular, okay, which is blood vessel, heart, breathing, what is it? For
Lungs.
which? Lungs. Okay, lungs. What else? What else? Epinephrine. Which organ? Epinephrine secreted by
Adrenal
Adrenal
gland.
gland.
adrenal gland. So these four are the main players. Okay, so the blood need to be supplied to the adrenal gland first so that it can secrete all the epinephrine. And once epinephrine has been secreted, this epinephrine will travel inside the bloodstream and go directly to the needed site. As you mentioned, it's in the muscle, it's in the heart, it's in the lungs. So they don't go to the digestive system. It's not important for this time because you're gonna fight. So this is the fight mechanism. They will, your body react to this stimulus. The dog come to bite Gopal and then he just run away. Okay, so the body have this automatic system for them to react and respond efficiently. Got it? Okay, you move on to the next slide. I will ask Shikin and Alia. So please be careful. I know your adrenaline and epinephrine now is max now, but don't worry too much. Anyone who can explain this?
Okay. For this part is transmission virus, Lisa virus, Clostridium tetani, and Staphylococcus are types of bacteria that we can get from dog.
Which one is a virus? Which one is bacteria?
Lisa virus is virus. Staphylococcus is bacteria, right? And Clostridium tetani is also bacteria. Okay.
So what's the relation? Why do you mention the three microorganisms?
Because this virus and bacteria will give if someone bite is sekejap. Saya cakap this virus will give a disease to someone who got bite with dog.
They are all three microorganism at a time, or they are separate one?
Separate one.
Okay, carry on.
The Lisa virus are a diverse group of virus capable of causing rabies, which is an invariable fatal encephalitic disease in both humans and animals, which affect the central nervous system, which is our brain and spinal cord. Mode of transmission is bite of infected animal, licking on an open wound or intact mucous membrane. Rabies can be spread when infected saliva gets into an open wound or mucous membrane, such as mouth and eye. Why? Tetanus is an infection caused by bacteria called Clostridium tetani. The spore can get into someone's body through broken skin, usually through injuries. Tetanus bacteria are more likely to infect certain red skin. When these bacteria enter the body, they produce a toxin that causes painful muscle contractions. And the last one is staph infection are caused by bacteria called Staphylococcus. They most often affect the skin. They can go away on their own, but sometimes they need to be treated with antibiotic.
Antibiotic is for what?
Antibiotic to prevent the staph infection.
Antibiotic being prescribed to kill what organism?
Can you repeat the question?
When do we use antibiotic?
To kill bacteria.
Excellent. So we use antibiotic to kill bacteria. Alia, how about the virus? Where is Alia? I cannot see you.
Can you repeat?
No, I cannot repeat.
Virus. Maksudnya nak kill virus ke?
Yes. How do we kill the virus?
Using vaccine?
Are you sure with vaccine?
Sure.
What is vaccine? Chicken, what is vaccine?
Pfizer for COVID-19.
What do you say?
Pfizer kan?
Dia akan stimulate the body immune response.
Yes, but the vaccine itself, what is the vaccine? What is the content of the vaccine? Atika, what is the content of the vaccine?
Genetic of the virus. So sorry. I thought that my mic was mute.
So which one is your answer?
I think vaccine contain the genetic of the virus.
Mm-hmm. Only that.
Water. And it's contain weakened or inactive part of the particular organism, which is antigen.
What is it? So if this is a viral infection, so why you need to give virus to them?
It's for the immune system
For what?
for fight the virus to
You got infected by the, for example, if you got infected by the Lissa virus that caused rabies, and then you give the vaccine to yourself, which is the virus itself too. So you got double infection. Because you mentioned that the vaccine contains genetic material from the virus. Can someone clarify to me? All of you have been vaccinated, right? Yes. So what's so funny? What's so fancy about the vaccine? Falila.
Yes, sir. Apa ni? Vaksin ya. Vaksin ada like the dead virus cell. So get in our body, so the immune system can recognize it and fight it. So when we actually get the virus, the immune system can like fight it. Yeah.
Brilliant. Okay, you got the lecture I told you last night. Okay. So the vaccine contains the weakened virus. Okay, the weakened virus. At some point, there is also chances that the virus can become activated again. Okay, but that is not a full functional virus. So inside the vaccine, so you will be injected with that virus, okay, that has been weakened, that share the same structure as the COVID-19. For example, in the case of Pfizer, for the COVID-19 disease. So you have the SARS-CoV-2 virus, right? So the vaccine has been formulated in a way that they have the same structure like the COVID-19 virus, but it's only weakened. So even though you are not infected by the virus yet, okay, but we give you the vaccine in order for your body to learn how to handle the real one. Okay, so the Pfizer that you are taking is actually contain the genetic material or the virus of the COVID-19 virus. Understand? Because your body need to be trained in order to produce immune response or immunity, or specifically we call it antibody against that weakened COVID-19 virus inside the vaccine. So when you get infected with the real COVID-19, your body already have the antibody. All right. So we kind of training your body to produce the IgG or IgG or IgM, so that when you get the real COVID-19, they already have the antibody to fight against it. So that's the concept of the vaccination. But in my case here, in your case here, I ask you antibiotic. When do we use that? Okay, when do we use the antibiotic? We use antibiotic to kill the bacteria. And we use antiviral to kill the virus. So that's the answer, not necessarily the vaccine. Okay, the vaccines is for the person, but the first treatment should follow the guideline. So in Malaysia, you have this CPG. What is CPG? Have you learned about this before? Yes? Have you learned about the CPG before?
No. No, better.
No, you don't know about that? You find out what is CPG. Okay, so for each disease that we have in Malaysia, endorsed by the KKM, Kementerian Kesihatan Malaysia, they have the clinical practice guideline. For patient with this Clostridium tetani infection, for example, what is the action that needs to be taken at the clinic or at the hospital? So the Kementerian Kesihatan Malaysia has this guideline. So you need to follow this stipulated guideline. All right. Okay, we're not following the US guidelines or Australia guideline. We just use the Malaysia guidelines. All right. So next, move on to the next slide.
Okay, that's for the sign and symptom of infectious disease. I will explain for staphylococcal infection, tetanus infection, and rabies infection. For staphylococcal infection, naturally, dog carry the staphylococcus bacteria in their saliva, and according to CBG, those who have been infected by this bacteria will experience flu-like symptom, and this symptom can appear from weeks to months. And other sign and symptom that will appear is the first one is red stripe around the wall, or we call it as blister. Blister is a pocket of pus that develop in a hair follicle or oil gland. And to heal this, it might take 10 to 20 days if not treated. But if we treat it, it might take just several days. And then for the next one is fever and chill. This is also known as bloodstream infection because the staph bacteria into the bloodstream and will affect the blood pressure that lead to hypotension. And the last sign symptom is achilles and pain.
What is the D6.3? Is that the fever? What is the temperature for this one when you get this staphylococcal infection?
Pardon?
36.3 in the thermometer. Can you see the thermometer?
It just apa panggil it just apa tu?
iPhone? This is not iPhone. This is thermometer. What do you say?
Ni apa macam dia kat sini? Just for decoration, Doctor.
Why do you want to decorate?
To make the slide more fun, interesting.
My question is, it mentioned about 36.3. What is your expectation for this patient that has the fever and chills? What is the current body temperature? That's the question. You can give range. It's not necessarily to be specific.
38 and above.
38 and above.
Yes.
And do you think that is the very high temperature? Are you sure? 38 and above? Time is running.
Between 37.8 and higher.
Between 37.8 and above.
Yeah, yes.
Yes. So you consider this as a high temperature.
Yes.
Okay. It can be 36 that you mentioned here, 36.3. So it's not included. Okay. So you mentioned about the staphylococcal. What is staphylococcus?
Bacteria.
It's a type of bacteria. How many, what is the main classes of bacteria? How do we classify the bacteria? Camellia? How many groups of bacteria? You've learned about the microbiology, right? So you must know about this. Just recall.
5 group.
5. What are they?
Spherical, corky, root, like spherical, spirilla, comma, vigorous, or corporeal. Spiro.
Okay, so that is what? Is it the group?
Shape.
It's what? That's the shape, right? That's the morphology. My question is, how many types of bacteria do we have?
6, doctor.
Now you're increasing it a bit more. Okay, tell me, what is the 6th one?
Bacteria, archaea, fungi, algae, protozoa, and virus.
And that is a bit, you know, exaggerating now, because I'm asking you about the bacteria only, not another kingdom. Huda, how many, Huda? Yes, you can. Very simple question. Yes, how many?
Gram-positive bacteria.
Brilliant. Okay, so we have gram positive and
Gram-negative.
very good. So gram positive and the gram negative bacteria, not based on the shape, not based on the kingdom, but the bacteria itself. How do we classify them? Of course, we need to know about the structure, not the shape. The structure of the bacteria composed of their outer layer, inner layer, how thick is the peptidoglycan, and that will determine, okay, the type of the bacteria, whether it's gram positive or gram negative. And it's also determine the type of antibiotics that you will prescribe later on. So if the antibiotic is meant for gram positive, so it cannot be used for the gram negative. Okay, same goes with the other side. So in the case of staphylococcal infection, may I know what is the type of the bacteria?
Gram-positive bacteria.
Okay, very good, Nasratul. So what really the difference between the gram positive and gram negative bacteria? What makes them differ? Alia?
Saya Alia doktor, dia Shikin.
Huh?
You want to ask me or
I don't know. Who is you?
I Alia?
You is Alia.
Yes.
Okay. Because your name here Nurul Ashikin and then plus Alia on the right. So you change now. Alia on the left. Alia is the blue tudung.
Yes.
Okay. Shikin. Okay, Shikin. What is the difference between the gram positive and the gram negative bacteria?
Gram-positive bacteria have a thick peptidoglycan layer and no outer lipid membrane, while gram-negative bacteria have a thin peptidoglycan layer and have an outer lipid membrane.
Excellent. Okay, so that is the differences. Okay, that is the main differences. When you do in the lab session later on, you will do the gram negative and gram positive staining. Hopefully, you can see the differences. Okay, by looking at the under the microscope, hopefully you will differentiate. And the staining is based on the peptidoglycan layers. Okay, that is how scientists used to differentiate them in the lab, or else we don't know what are the difference and how to prescribe the antibiotics. So once you know that this is gram-positive bacteria, okay, it is possible for you to prescribe the antibiotic for gram-positive. Got it? Okay, we move on to the next slide.
For tetanus, most people call it as lockjaw because of the symptom itself, which is a spasm of jaw muscle. And this infection can lead to serious health problem. For the sign symptom, we might get seizure, which is uncontrolled electrical disturbance in the brain. And it happened when the tetanus toxin interfere the release of neurotransmitter and blocking the inhibitor impulse, and it can lead to muscle contraction and spasm, and we might get muscle stiffness. And for other symptoms, we might get fever and sweating, headache, and also trouble swelling.
Okay, very good. Next.
And then for the rabies, rabies, it have wide range of symptoms, and if we got this kind of infection, it can infect our central nervous system of mammal and can cause disease in our brain and death. And the common symptom, we might get general weakness or discomfort in our body, and we can also get headache and fever, and we might feel like a pricking and itching sensation, and also if it's severe, we might get anxiety, confusion, and agitation. That's all.
That's all for today.
No.
Huh?
That's
You
all
want
for
more?
the sign.
Okay. You want to continue?
Yes, sir.
You can continue if you want. I want to go back. Okay, how many time left? How many more slides to go?
Six.
6 slides. Okay, 1 more hour. You continue.
Okay, next I will talk about treatment and management for dog bite. Okay, first of all, we need to clean the skin around the wound with soap and warm water. We can also use antiseptic and try to get not into the wound lah. Then try to remove any object like teeth, hair or dirt from the wound using running water. Then gently squeeze the wound so it bleeds slightly. That can help to reduce the risk of infection. The next one, press dry dressing or clean clothes firmly onto the wound to stop the bleeding if it's bleeding heavily. Next, after cleaning the wound, gently pat it. Pat is mean touch quickly or gently and light touch with the hand lah. Then cover it with clean dress or cover the area with bandage. Make sure bandage we need to change several times a day. And then we need to take a paracetamol, acetaminophen, and or ibuprofen to help ease any pain or swelling. Then we need to see a doctor when we don't know the dog has rabies vaccine story or the dog that acting erratically appear to be sick and doesn't stop bleeding, cause intense pain, expose bone, tendons, or muscle, cause loss of function such as inability to bend fingers, looks red, swollen, or inflamed, leak pus, or fluid. That's all.
Okay, after you get the first treatment, you have to prevent the infection. As you know, the dog bite didn't heal quickly, so it take time for the infection to get slower and loose.
Wait. My question is why do you want to prevent the infection?
Because I want to make the thing didn't get worse.
But do you know what is the things that is happening to Gopal?
Hmm?
Do you know what is happening to Gopal? Nabila, you don't know?
No.
You can
Gopal
guess.
got bite from a dog.
Yes, that's true.
So the dog bite might get infect Gopal. Gopal might get infected from the bacteria from the dog saliva.
Okay, I got it. But did you know what type of infection before you treat it? So do we need to treat them to treat him or not?
First, we have to identify the infection that Gopal have.
Brilliant, Atika. So before you go to the prevention or treatment, okay, so make sure you know what type of the infection. Okay, it's either bacteria or viral infection. You can put in the slide, but this is quite general. You mention here on the left hand side at the bottommost point, you say if your doctor prescribed antibiotics. Are you sure this is the bacterial infection? You're not sure, right? So make sure
Yes,
you
doctor.
confirm and identify what type of infection first. Okay, put one table. If it's bacterial infection, use this drug. If it's viral infection, use this antiviral drug. Okay, so that's how you did that. So if you do like this, seems like you didn't know what is happening to him. It's either bacteria or viral infection, and then you just give whatever things you want. So it's not specific. It's not solving the issues. It's not helping the patient to recover. All right. But you just like want to kill Gopal. You don't love Gopal anymore, do you? Okay. So next slide. So I think this is not relevant for now. Okay, move on. Yes. I'm waiting. I will sleep 9:30.
For the blood clotting, the process starts with the bite from the dog that damages the blood vessel, which can cause immense loss of blood inside the artery, and platelets will attracted to the site of damage. This step is called adhesion, which is platelet will bind to the collagen fibers. Collagen fibers be the site for the platelet adhesion. So the first platelet that rolling around in the bloodstream will be attached to the collagen fibers. So once platelets stick on the collagen fibers, it will be activated and invite their friends, uh, like other platelets, to bind with them. So then they will change in shape. Activated platelet will release some protein and molecule inside the granule. In granule, it has ADP, serotonin, and thromboxane. So to active the other platelets and sustain vessel contraction and blood flow. So it will form a platelet plug. The release of ADP makes other platelets in areas sticky. So the stickiness of newly recruited and activated platelets cause them to adhere to the original activated platelets. So for blood clotting, there has 3 stages, which is formation of prothrombinase. Second one is prothrombinase converts prothrombin to thrombin, and the last one is the thrombin converts soluble fibrinogen to fibrin 3. So there has a 3 pathway, which is extrinsic pathway, intrinsic pathway, and common pathway. For the intrinsic pathway, it happens outside of the blood vessel. So the tissue damage make the blood vessel wall lacking. So the homeostasis happen quickly. It will produce tissue factor, or we call it thromboplastin. So with the presence of calcium ion, it can the prothrombinase is formed. For the intrinsic pathway, it happens inside of blood vessel. So when the blood trauma, it will stimulate inside the blood cell. The damage endothelial cell and platelets expose collagen fiber. It makes the blood pressure high and cause injury in blood vessel. It's activated new platelet, which is platelet phospholytic, and with the presence of iron calcium, prothrombinase is formed.
Ashikin,
Yes.
is that your name?
Yes.
Ashikin, why do you show me the mechanism of blood clotting?
Can you repeat?
Why do you show me this slide? Why is it what is so important about this slide? Why you choose this slide?
I want to show the process about the blood clotting happen.
Why the blood clotting is important?
To stop the bleeding from the dog bite.
The bleeding from the dog bite?
Yes.
Okay. So what happens? What happened to Gopal? What happened, Ashikin? Do you understand my question?
Did Gopal got bite by the dog? So blood clotting happened because to prevent the blood from flowing out from Gopal body.
Who make
Blood-
the blood
blood
clot? Who make the blood clot?
Platelet.
Blood loss. I think blood clotting help to prevent blood loss.
Is it automatically happen, or the body, or you inject something to clot the blood, or any drugs?
Automatic.
So it occur spontaneously. Okay, so when the dog bites Gopal and you assume that the body have a self-healing response where the blood need to be clotted. Why do you need to make the blood clot?
So Gopal will not lose too much blood.
Very good. So it's kind of healing. Okay, it's stopping more blood to come out from the injury side or from the bite side. Okay, so for this mechanism or for this process to happen, how long does it take?
Depends on the size of the wound.
Very
If
good.
it's smaller,
Yes. So if
if
a
it is
small
smaller,
bite,
it takes less
quicker.
time.
Okay. If a small bite, it's quicker time to clot, right? If it's severe, up to the bone area, for example, major cuts, so it will take longer time to clot. And now you are telling me about the process of the blood clotting. So the main aim or the main purpose for this blood clotting process is to prevent more blood to come out from the blood vessels or from the tissue. Okay, and it occurs spontaneously. Okay. However, it's also possible in the case of real dog bite, you can also help the blood to stop by,
Putting pressure on the wound.
okay, put some pressure on the wound. And what else? What else? Come on, you are the future professional nurse. You know this answer. How to stop the bleeding?
Give injection.
What type of injection? You will kill the patient. You saw the blood is coming out and then you add more injection. And then the blood still coming out, you add another jab. No, we don't do that. What do we
Cover
do?
the wound
Again?
and then put some iodine.
Iodine, are you sure? Quickly put some iodine. Is that the way? Okay, so make sure it depends, okay? Look at the severity of the injury or the wound. Maybe you want to sanitize or clean it up with the warm water first, okay? Clean up first, and then you can wrap it around with bandage or anything. Okay, maybe put some iodine in order to reduce the contamination or infections. Okay, so this is type of antiseptic technique that you need to apply. So now this is the mechanism. You cannot see this is happening in Gopal, right? So this is based on the scientist's assumption that the process involved in the blood clotting. And you mentioned that if the clot, if the wound is very minor, it means that the time to clot is quicker. And this is the process from prothrombin to thrombin, fibrinogen to fibrin until they can seal the wound area. All right. And in the coagulation pathway, you mentioned intrinsic and extrinsic. And of course, this is a step-by-step process again. In this slide, it is important for you to know the name of each factor and what do they do. Okay, so for each one here, for example, in the intrinsic pathway initiated by injury in the vascular endothelium, this is lower and more important. You can see factor number 12 being converted to nothing. And after that, at the bottom, factor number 11 converted to nothing. What are these X22A? What is this 9A? What is the VIIIA? So you have to tell me. Each of these factors, they have their own function. All right. So please rewrite these factors. I think it's over 16 different factors. And what are their job? What is their function? You need to tell me about that in the next PBL, okay? All right. I want a more explanation, detailed explanation that I can understand for this mechanism of blood clotting. All right. Next slide. Is that it? You say it's another 6? Or you deleted some of the slides because you want to go back early and eat? Okay, so you say don't hesitate to ask any question. So I love to ask question. I will not hesitate to ask question. Is that all for today? Or you got another slide to show me?
That's all, sir.
That's all. Okay, very good. So what else that you need to know from me? Have we solved Gopal's problem?
Yeah.
Have we solved the issues?
Oh, not yet.
No, not yet.
So what do you want more?
Trigger two.
What do you want from the trigger two?
I want to know. I want to know more him about the disease.
What do you say?
We want to know more about the diseases or the infection.
Okay, you tell me what more do you want to know? What are the things that you want to know that is important for you to know?
The real system, symptom.
The real symptoms, what do you mean?
What kind of symptom that Gopal have so that we can focus on the disease more detail.
Okay, so you're asking me about the symptoms. So after the first trigger, you know that he's been chased by the dog, right? And then he fall down around 200 meters. He's keep on running and fall down. The dog bite him, so he cried and he went back home. After 1 week, he started to have fever. Okay, he started to get fever after 1 week. So he didn't go to that school anymore. So he just stayed at home. He developed fever. And also he got headache. Headache. Okay, I guess that's the second symptoms. And the third one, he got some itchiness sensation at the bite side. Okay, so he's keep on scratching, which is not good, okay, because it can make it worse. And some additional symptoms, like he also experienced seizures. You know seizures? Seizures, yeah? So he also experienced seizures. And what happened is that his father bring him to the hospital and check his blood. Okay, the doctor looked for his blood and found he was positive for viral infection, but not sure what type of virus. All right, so that is up to you to find out what is the real case or scenario that is happening to Gopal. I would like you to understand and fill up the filler table again. Okay. And if you got any question, you can ask me now. If there's any terminology that you did not understand, you need to discuss about the facts for the second trigger. Okay. So the ideas also for the second trigger, the learning outcomes or the learning issues, and also the action. Okay, so each trigger you need to prepare your own filler table. But for the next couple of weeks, I think next week, a discussion, we will focus on the pathophysiology of the fever. Okay, we focus on the finding out what is the real diagnosis that is occurring in Gopal. How the fever occur. If it's the viral infection, what is the most common symptoms? And how does it differ with the bacterial infection? I would like you to identify the sign and other symptoms. What is the risk factors of these virus infections? If you can find out the lab diagnosis, if Gopal has been diagnosed with viral infection, what are the further lab tests that need to be done in order to confirm that he got the viral infection? And after that goes to the treatment and also management of the patient. The treatment includes whatever pharmacological drug that is essential to stop the spread of this viral infection. And how do you manage the patient, especially at the wound site, okay, at the bite site? How do you clean up? Is it good to use iodine? Okay, is it common to use alcohol? You tell me. If it's drugs, antiviral drug, what is the name of the drug? What is the concentration of the drug? How frequent that he need to take in a day or in a week? All right, so you discuss the treatment, the management, how do we prevent this from spreading? In other words, how do we stop Gopal from dying because of this viral infection? And finally, I want you to discuss this Islamic values. Although I think Gopal is not Muslim, but how you can integrate Islamic concept or any Islamic values inside this case. Don't say to me Gopal should embrace Islam. Okay, so you should mention something like the cleanliness. Okay, need to observe carefully, like Muslim have wudu. Okay, we used to have this quite often. Got it? All right, in my class, in all of my PBL session for my group, I really like if you can explain me the mechanism or the pathophysiology or the pathogenesis of a certain disease. In this case, we are considering the fight and flight response. You have mentioned about the central nervous system, but it's still superficial. It's not really deep. Okay, it's good if you can discuss the fight and flight reflex by the CNS again. Explain to me, simulate to me when Gopal is running away from the dog. Okay, what is the body system activity that is occurring during that time. You already mentioned adrenaline becomes secreted, increased breathing pattern. Okay, I want you to put on some images or illustration so that you can further elaborate on this. Okay, add some more figures to explain this. Other than that, as I mentioned earlier, the blood mechanism, okay, the blood clotting mechanism start from the injury, the vascular spasm, the platelet plug formation in order to stop the bleeding. Make one table to include all the factors that is involved during the blood clotting mechanism. Like factor number 1, we call it fibrinogen. Factor number 2 is prothrombin. Factor number 3 is tissue thromboplastin. Factor number 4 is calcium ion. Factor number 5, proacelerin. Okay, so you tell me what is the alternative name for this and what is their function? What is the job they are doing in the system to facilitate the blood clotting? And that's it. All right. Other than that, I've mentioned sign and symptom is important. How do you stop the spread of the virus? What is the drug that's commonly prescribed? If it's virus, tell me what is the name of the virus. Come up with the figure, the structure of the virus. Okay. What is the classification of the virus? I told you yesterday, RNA or DNA virus, you tell me. All right. So you will be evaluated based on your performance during the PBL. The more you talk, okay, not necessarily the right or wrong answer, but the confidence you in my session to speak out and tell me the answer is the most important thing. Okay, don't be shy. I'm not concentrating on the whether it's wrong or right. Okay, it's your effort to contribute to the discussion that matters. All right, everyone, good. It's already my bedtime. I hope you enjoy the rest of the night. Please remind me again for the next session. If you want to have it any time, please don't feel sorry to contact me, okay, through WhatsApp or just drop it in the WhatsApp group. Any last question before we end the session? Everyone, anyone? No? There are more tougher questions to come next week. So I hope you can enjoy the rest of the night. Make sure you distribute all the tasks together. Make sure you have an equal distribution. I already took some of the marks. Some of your friends already perform better than the others. Okay, for the next session, it's good if you can volunteer yourself. If I ask your friend and they cannot answer, you will unmute your computer, laptop. Doctor, I want to answer that question. Doctor, can I interrupt? Doctor, maybe it's like this, not like that. I think it's better to go this way than that way. Okay, so it really matters your effort or your contribution to the discussion. Okay, good. We close the session by recitation of Tasbih Kafarah and Suratul Asr. Subhanakallahumma bihamdika asyhadu an la ilaha illa anta astaghfiruka wa atubu. Wal 'asr innal insana lafi illa alladhina amanu wa 'amilus solihat wa tawassaw bil haqq wa tawassaw. Okay, good night everyone. Make sure you recite 3 Qul before you go to sleep. Okay, I'll see you again next time inshallah. Assalamualaikum warahmatullahi wabarakatuh. Bye bye.
Thank you, doctor.